The research program is something that we really care about over here. We established, in the past 3 years, we were able to establish an excellent clinical research program to deal with all aspects of cardiac surgery. However, my main focus is obviously atrial fibrillation research. And knowing the nature of the disease and the nature of the intervention, I knew all along that having a solid clinical research program to include data collection as well as follow-up is essential to increase our success rate with patients. So therefore, we established a unique atrial fibrillation surgery registry to include all the variables that are important to be included in the follow-up. We have a unique quality of life follow-up for all patients. And of course, we have a nurse practitioner who is directly in charge to have a complete follow-up and assess patients for various problems down the road. So unlike many other programs, we don't just operate on patients. We are interested in their outcome and future intervention in order to increase the success rate and for the benefit of the patients in the long run. I think that one of the things that really surprised me was that the education piece of what's the MACE procedure, not just for the patient, but also to the medical profession world, is lacking, not just in this area, but also in the US. Meaning, what does it mean to have the MACE procedure? What does it mean to have atrial fibrillation or so-called early failure after the procedure? How can you intervene in order to really put the patient back on track? And many of my colleagues here and in the US are getting the sense now of how important it is to intervene even 6 or 8 months after the procedure if atrial fibrillation reoccur with interventions that are relatively simple, such as anticoagulation, antiarrhythmic drugs, and repeated cardioversion. That's the number one surprise for me. And therefore, the importance of our clinical research program is very clear now, not just for us, but also to the patients and to the physicians that are involved in their treatment down the road. The other surprise that I always have is how many patients are having what was considered to be atrial fibrillation only, and when they come to us and have surgery, being assessed for surgery, we discover that they have other problems. In a matter of fact, about 20% of the patients that we evaluated for surgery for atrial fibrillation only ended up having other procedures done for valve disease and coronary artery disease that were significant. In the recent month, we started to have an extensive basic research program in order to try to understand the cellular mechanism of atrial fibrillation. It's an exciting collaboration with George Mason University, in which we are looking into genes and proteins that are involved with the disease process, and hopefully we can come with some other options of treatment in the near future.